Ministry at St. John Baptist Church. I would like to welcome everyone for your desire to participate in this COVID-19 presentation. This pandemic has been in existence for almost a year. We have experienced many challenges, but our faith has sustained us to keep us marching forward. We have ingested an enormous amount of information on this virus and vaccine, but it is still much more to grasp mentally in order to help alleviate some of our distrust and fears. With this being said, I am so excited to introduce our guest presenter for today. Dr. Nicole Pryor is a community pharmacist with a decade of successful experience in retail pharmacy. Dr. Pryor specializes in patient-centered care within a retail pharmacy setting and annually promotes wellness clinics to showcase new healthcare trends such as self-monitoring, diseases states, wellness apps, and healthy tools to promote better health. And Hamptonian alumni, Dr. Pryor is a strong believer in educating the community she serves, regularly recommending healthier lifestyle choices, promoting self-awareness, and conducting health screenings. Dr. Pryor is the pharmacy manager for a large retail chain and a proud member of Minority Women Pharmacists Association. When she is not grooming her pharmacy for success, Dr. Pryor enjoys partaking in a good time with family and friends. And just to note, if anyone have questions for Dr. Pryor, she may not be able to get to it right away, so please use the chat and write down your questions, and she will definitely follow up with you.
Excellent.
Okay, Dr. Pryor, you may start your presentation.
Good morning, everyone. Thank you so much for this opportunity to be able to share and discuss the current available COVID vaccinations that are available on the market now. Do I have screen share set up already? Yep. Let's see here. All right. So the presentation that I'll be presenting today will be addressing COVID-19 vaccines that are available currently on the market. These vaccines will either, if you have already received the first vaccination, more than likely receive one of the two that are available on the market. However, we are learning today, and last night I got an alert that the Johnson & Johnson vaccination is actually currently being approved by the FDA, which probably won't be available until probably the early part of April. But as of right now, if you are currently signed up for the vaccination, well, you will be receiving one of the two that we will be discussing in today's presentation. As she's already introduced, I am Nicole Pryor. I am a Hampton alumni, and I am currently a pharmacist at the local CVS in Williamsburg. I do ask and encourage patients, if you have questions or concerns, we're going to wait until the end of this presentation. However, if I am not able to address your question, I do ask that you either email it to me, write it down, and I will get back to you and follow up. But me, as well as my partner, are always accessible at the local CVS as well. Okay. So the objectives of this presentation, we will review the types of vaccinations that are currently available on the market. We will also discuss how the available vaccines work, benefits of vaccination, hesitancy that we see in our community. You might be one of the people who are hesitant to receive that vaccination. We will discuss some of those concerns and how we can kind of debunk a lot of the misinformation and conspiracy theories that we are encountering. Right now, we will discuss determining what groups are currently being vaccinated. And like I said, at the end, we'll have questions. And then I do have a slide that has my information at the very bottom of it. Okay. let's go here. So currently what we have are the types of vaccinations that are currently available on the market. Now, the Pfizer, BioNTech, and the Moderna are the two vaccinations that are currently available on the market. These vaccinations are, as I stated, more than likely what the Virginia Health Department has, as well as if you've received it from Sentara or Riverside, as well as CVS. The Johnson & Johnson just received its FDA emergency use authorization as of late evening yesterday. And so I'm pretty sure they've already started started production. However, most facilities probably won't receive this vaccination, probably not until the early part of April. And I do have some information that I do want to touch on with the Johnson & Johnson, because it is a different formulation. It has different technology that it utilizes for combating COVID. Okay, so let's go here. Now, AstraZeneca, I may mention that as well. So with the AstraZeneca and the Johnson & Johnson, they use viral vectors. With viral vectors in comparison to the mRNA, they're different in perspective of how they work and efficacy. With Johnson & Johnson and AstraZeneca, we noticed that with theirs, it takes a longer amount of time for you to develop efficacy. However, it only requires one shot. Whereas Moderna and Pfizer, there is a two-part series, okay? So on this slide, we'll discuss how Pfizer and the Moderna work differently. Well, we'll just talk about basically the storage. We'll talk about the dosaging and the efficacy. We'll touch briefly on some side effects, because that has been a concern when it comes to receiving a vaccine. And we will also touch a little bit on if you have an anaphylactic reaction. Some information is not available because we are still documenting and getting information from patient populations on side effects. And see here, I apologize. And a lot of data is being recorded. So a lot of the questions that people have regards to the vaccine, we will be able to address, but anything further outside of, anything specific, we'll have to address at a later date. So with the Pfizer BioNTech, it has mRNA technology, and it is currently under emergency use authorization. With this, we do require a 2-dose series. This one, you will receive the first one on day 1, the second dose 21 days later. This is an intramuscular injection where it goes in the deltoid muscle. They do recommend patients over the age of 16 receive this vaccination. We do realize with this, the storage of this medication causes it to be a little bit more sensitive. We do have it to currently where CVS has this available with more long-term care facilities, as well as the health department. And because the storage of this medication, it tends to be utilized as soon as they receive it. So whereas with the Moderna, you have a longer shelf life, and that allows us to utilize it more frequently for the remaining population. Whereas with clinics, they tend to use the Pfizer because of the storage of it. It does require dry ice, which can be a little bit difficult, more to handle. So a lot of the clinics that are set up utilize the Pfizer. So with using the Pfizer vaccination, after receiving the first dose, patients tend to have a 52% efficacy. After the second dose, you receive about a 95% efficacy. So that's why it's so important when you are signing up for these vaccinations that you sign up for both your first dose and second dose. It should align with the same company. You should not jump from one company to a second company when it comes to receiving your first and second dose. You want to continue to wait. Now, a lot of patients are saying, well, what if they run out? Or what if I'm outside that 21-day window? It's okay. It's fine. You still should receive it as soon as it's available. You should not go to CVS for your first dose and then to the health department for your second dose in fear that you won't receive it. The idea is that you need to continue to stay with the one company, because if we have any side effects, if we have anything that happens, we're able to document and we're able to trail back to figure out what the issue is. We don't want it to be an issue where you go to one department and you receive it, and then you have a reaction after receiving a second dose. And it just increases compliance, and it's just easier for documentation. And they need that information for our community to know what it is that's going on. As I stated, 52% efficacy after about 14 days of receiving the first dose of the Pfizer vaccination. After the second dose, there is about a 95% efficacy for 7 days after receiving the second dose. Now, as far as side effects, we see at the local injection site, we see some mild to moderate pain, which is typical of receiving a vaccination because it's into the muscle. You might see some tenderness, some redness. However, we are seeing that it subsides after about 2 to 3 days, typically. Systemically, that means that if we have any body reactions, we see that resolve within 1 to 5 days. Most of the times we have patients who have experienced some weakness in the muscles, some tiredness. But as I stated, typically those resolve within 1 to 5 days. Now, less than 1% of patients have reported any severe pain or redness or swelling. However, if they have, it does resolve within 1 to 2 days, sorry. Now, let's see here. Now, the Moderna. The Moderna vaccination also has emergency use authorization through the US. It also, as well as a 2-dose series. It is injected into the muscle as well. It is recommended for patients over the age of 18. It does not require dilution, which makes it a lot easier to handle, which allows us to make sure that we are able to vaccinate more patients because of the storage. It doesn't require special dry icing. It can be refrigerated. It has a longer shelf life. So we do tend to see that most companies would prefer the Moderna over the Pfizer. The reason that Pfizer was the first one on the market who was able to ship out and meet that supply and demand that the federal government, needed at that time. So that's why we see so much Pfizer. They both have an efficacy rate of over 95%. So one doesn't supersede the other. It is just more so the availability of which vaccination you'll be able to have. As far as adverse effects, we tend to see the same type of side effects, very mild to moderate pain at the site of injection. Once again, we have noticed that patients who are over the age of 55 tend to do better with the vaccination versus younger adults. They haven't figured out why. I think a lot of it just deals with the body and the way that the body reacts. I think I can't really give you a solid answer, but we do notice that patients tend to do better that are over the age of 55. Now, what I do like about the Moderna is that after the first dose, after 14 days, you have a 92% efficacy rate, which is phenomenal. That means that in comparison to the Pfizer, which is at 54.2%, you notice that you have less of a chance of either spreading or contracting COVID when it comes to encountering those two patients. I would say that might be the only benefit outside of Pfizer. However, after you receive both doses, they both have the same efficacy. So I always encourage, if that is what they have available, that is the one you want to get. You don't want to say, oh, well, I prefer Moderna over this one. You want to make sure that what they have available is what you want to be vaccinated with. After the second dose, we are noticing that patients have a 94.1% efficacy rate 14 days after receiving the second dose. Now, with the Moderna, there were 4 cases of Bell palsy, which occurred after a group of individuals in the trial era was vaccinated. However, people have to consider the patient populations that are being tested. This was 4 cases out of, almost 10,000 patients at that time, which means that is it clinically significant when you're discussing information like that? No. However, it was still reported. So we want to discuss this because people are like, oh, well, I don't want to get it because of this. But the reality is that there's different reactions and different things that occur when patients have side effects. Patients have different comorbidities. They are on different medications that can cause and interact with the vaccination. However, we still encourage patients to be vaccinated regardless of that, because we know that patients in our community tend to be impacted by COVID at a larger percentage than any other group. And that is a reality. And we have to understand that when we are going into, the unknown, or knowing when we are in an area of, we're desperate at this point. And it's sad to say that a lot of people in our community just have a lot of hesitancy. It's a lot of mistrust within the healthcare community. And I think I'm doing my due diligence to reach out to patients and people in our community to let them know how important it is for us to become vaccinated, to be educated, to have access to healthcare, so we're not dying off in large numbers. We go into hospitals and we don't come out. And a lot of that is dealing with the fact that we don't want to be in a position, because, like I said, we'll discuss a lot of those conspiracies, but I want people to be encouraged to be vaccinated and not look at a lot of the side effects, because, like I said, that 4 cases of Bell palsy, if those patients have any type of other neurology or nervous system type of issues, that can impact what happened when they received that vaccine. Okay, now as far as let's move along with serious allergic reactions. Typically what we see is they do a catecholamine injection, which helps with the cascade of having an allergic reaction. In addition to that, they do provide respiratory support in the event somebody has an anaphylactic reaction. Anaphylactic is when basically your throat closes up, can't breathe, swelling of the tongue. You might have swelling in the face or in the lips. Okay, so those are things that you definitely want to pay attention to in the event that you do receive the vaccine. Now let's see here. Can you see my next slide? So let's discuss how the COVID vaccine works. So the difference between, let's see here. Now both the Pfizer as well as the Moderna work the same way. Both vaccines work with novel messenger RNA. The mRNA carries instructions to the COVID spike proteins. So when you look at this diagram, it gives you a very simple explanation of where you see those spike proteins. So what happens is, and those prickly sites on the virus are like rubber balls that dogs chase. And what happens is once the vaccine is injected, the mRNA is taken up by macrophages. Macrophages is basically your body's natural ability to fight off infections. What happens is they instruct those cells to make spike protein. The spike protein then appears on the surface, inducing an immune response. This same response is what mimics the way that we fight off infections. It protects us from natural infections, just as well as when we fight or when we have a cold. Enzymes in the body then degrade and dispose the mRNA. So there's no live virus involved, and there is no genetic material that enters the cells or changes it. A lot of patients or people were under the impression that it changes or alters your DNA, and it does not. This is anytime that you have an infection, anytime that you have some type of foreign body enter the body, your body goes into fight mode. And so it's the same type of mechanism that you have when you have a basic common cold. Your body recognizes the foreign material, it then attacks the material. And then what happens is they have T cells and macrophages that help to fight off the protein in that foreign matter. And then what happens is your body recognizes it the next time that it enters your body. So the body knows exactly what to do. Now let's see here. Not moving. Now let's talk about the benefits of the COVID-19 vaccination. Both vaccines are remarkably effective. Vaccines lower the chances of developing COVID by 95% as compared to placebo. So we know the prevention of these diseases could convert COVID from a global threat into something manageable, like the common cold, or even like the current flu. We know that if patients are vaccinated, we're trying to reach what they call, I'm sure you've heard of herd immunity. That's a real thing in the healthcare community when it comes to that viruses and things that affect large populations of people. That is why it is so important, once again, for patients and for us to encourage patients to become vaccinated. Okay. Now, while both vaccines are given as a 2-dose series, protection it becomes apparent within the first 2 weeks of receiving the dose. And that's pretty common amongst all doses, all vaccinations, including even the flu virus. And as I stated, it is important to consider receiving the vaccination. Most trials that have been studied include a population of those that are at risk with COVID-19 complications. So patients were clinically stable, as stated, or otherwise healthy. However, studies did not show the efficacy of the vaccine in sicker populations. And those are populations living in nursing homes and severely immunocompromised patients. However, I did read an article yesterday evening that indicated that in New York City, with patients that have received the vaccine that are living in nursing homes, they have COVID cases have dropped down by 80%. So we know that with the vaccination, it is working. It is preventing large populations of people who are living in nursing homes to not contract it, which is very important. And now they are removing those sanctions that they put down on patients regarding, less visitations. They're able to go out more, and that's important for that group of patients. They have that contact with family. So we want to make sure that it's important for us to vaccinate. And it's not only for yourself, but for your family, your friends, and your coworkers. Patients, we have people on the front line, people who work in retail, people who work with people, grocery store workers, educators, people in the hospital setting. We have these people around us who are otherwise considered healthy, but they have been in what we call Group 1A because they're on the front line working with other people. And they have been vaccinated, and they encourage others to become vaccinated, because in order for us to help and assist, we have to first protect ourselves. Okay. So I think it's and another point is the importance of us receiving that vaccine is to end this pandemic. And it's not to end the pandemic to where, we're in large crowds again and we don't wear face masks and we're not 6 feet apart. No, the idea to end the pandemic to where we are still able to resume what we call somewhat of a normal life, where we're able to be in a setting, we still wear masks, we're still 6 feet, we're still practicing the hygiene, washing of hands, using hand sanitizer. All of those things will still be incorporated along with the vaccine. And what this will do is, like I said, help to bring some normalcy back to our lives. In addition to that, it'll decrease the amount of hospitalizations that we're seeing across the board. We're seeing patients that are hospitalized that received or come in contact with COVID or contract COVID. They are dying as a result of an exacerbation of their current disease states. Yes, the virus goes in and it impacts. If you already have diabetes, it's attacking those kidneys. If you already have a heart conditions, it's going in and it's attacking that heart. Those are the things that we are trying to fight against when we're dealing with receiving the COVID-19 vaccine. It's important for people who have comorbidities or what we consider high risk to receive that vaccine, regardless of age. But we are definitely right now focusing on that group of people who are 65 and up with comorbidities. Now, a lot of people have been hesitant because of how fast the COVID vaccines have been readily available. And I think people have to understand that when we are talking about a global pandemic, which affects not only the country we're in, but our surrounding countries and our brothers and sisters in the, in the East and the West and in Africa and South America and Europe, they have been impacted in the same way we have as well. And so when you consider that, you have to understand that funding is coming from all of these different areas. And that's what we need. We need unity when it comes to something that impacts us all to this level. It goes through the same rigorous approval process as all other vaccines. And what a lot of people don't realize is that with this vaccine, with the mRNA technology, it's been studied for more than 15 years. It's been used in other clinical trials. However, this is not something that just came out of nowhere. This is something that they've already been working on. And so what we know is that this medication received the proper approval process. It has, we have supplied manufacturing companies with what they needed in order to provide this vaccine. Reassuring patients that COVID-19 is safe is a top priority across the board. Neither of the two vaccinations contain a live virus. We know that reducing the illness severity, reducing the severity of the illness is what is one of the major factors of COVID-19. No, it is not a cure. No, it is not preventative of you contracting COVID. But what it does is it decreases the severity of the illness. It works and operates the same way as the flu shot does. Okay. Let's see here. Sorry, it keeps jumping around. Okay, so safer pathway toward immunity. And that's where we were discussing about herd immunity. It is important for us to receive the vaccination because it's an important step in developing what I consider herd immunity. And what that is where we have 70 to 80% of the population to become vaccinated in order for the remaining population to not be affected by it. A lot of patients prefer to take what we consider the natural immunity approach when it comes to COVID, but that would mean that hundreds of millions of people would have to recover from COVID in order for us to do the natural immunity. And that is why, once again, why this vaccination was developed at the rate it was, approved, and available as well. We know that COVID-19 has been associated with long-term consequences, even in young, healthy people. There's really no way to predict how severe a COVID-19 infection can be for anyone. And once again, that's why it is so important and imperative for patients who have high risk, who are high risk, including age, as well as comorbid morbidities, as well as those who are among people who have immunocompromised or working in nursing homes or frontline workers, why it's so important for us to become vaccinated. We do have some racial and ethnic minority groups that have struggled with when they come in contact with COVID. Evidence points that higher rates of hospitalization and death from COVID among non-Hispanic white persons, including Black and Brown people. And the reason this is because of underlying health conditions, exposure to essential service work, and access to care. I believe within our community, there has been a mistrust of healthcare, and it's those that look like myself and others where it is important for us to reach out to our community and let them know what's available and allow them to ask questions and be comfortable with asking those questions and being an ally between your community and the healthcare community as well. Here. So let's move on to the reasons for vaccine hesitation. And as I stated before, a lot of it deals with, what we've seen in the past with the Tuskegee experiment, or seeing loved ones who go into the hospital and they don't come out. The biggest challenge is the fact that African Americans start out with poor health outcomes as compared to white Americans. African Americans are at a higher risk for death because we are disproportionately sicker than our white counterpoints. And what that means is that a lot of times our patients don't receive healthcare until late into their disease state. I've seen that with my own family members. So we have concern when it comes to COVID encountering our Black and Brown community. Questions, concerns about the benefits, safety, and side effects. When it comes to the vaccine, a lot of patients are saying, well, I don't know what it does, or I don't see, I don't know, I've seen the 4 cases of Bell palsy. And so that raises concern, as they should be. And we can have a healthy conversation about this. You have side effects from a lot of different things, medications and things of that sort. But I still do not believe that should prevent you from receiving this vaccination. We've discussed the benefits of receiving COVID vaccine. We've talked about the safety of it as far as how safe it is. It has a 95% efficacy. It is no live virus. It does not change your DNA. Side effects, local injection sites, mild to moderate pain. If you've received any vaccine in the past, it works the same way. We do have patients report with some systemic, some muscle weakness, some lethargia, but that's not, that's common side effects when you receive a vaccination. Concerns about speed of development, process, and representation of people like myself, like me. We discussed the concerns around the speed in the development process. Patients were definitely hesitant because it came out almost 4 weeks after they announced it. And it was like, oh, well, why did this come out so fast? You have to understand, it was a global pandemic. It didn't just affect the US. So when you have cases like this, you have funding, you have resources from all around the world who are working on trying to figure out what is the best solution and finding out a solution for patients when it comes to the vaccine. Representation of people like myself. You will see a lot of times, you have patients who don't see their counterparts receiving this vaccine. So what happens is that they don't want to become vaccinated. That is why you see a lot of times we do see a lot more Black and Brown healthcare workers receiving the vaccine. And they're trying to put themselves out there to make patients more comfortable. And I think that's a healthy factor to consider when we see people like ourselves receiving the vaccine. There's a distrust in political and economic motivations of the government and companies involved. We've discussed how people believe that this is some type of way for the government to receive funding, or for the government or even pharmaceutical companies to get richer. I'm not sure if you are aware, but the COVID vaccine is available free under this current administration. You'd have no charge for it. It goes the same as well as COVID testing. If you do not have insurance, you are still able to receive that COVID test. If you do have insurance, you're still able to receive that COVID test. And it works the same way when it comes to the COVID vaccine. Misinformation, conspiracy theories about vaccines and COVID-19. As I stated, a lot of people stating about a microchip. There's no microchip available or within that vaccine. They're not trying to track you down, get your DNA and things of that sort. It's surprising to see a lot of these conspiracy theories. And I think what it does is it continues to allow this myth that creates fear, and that fear results in people not receiving the proper health care. And it's sad to say, and I think it's very important for us to educate, reach one, teach one, takes a village type of mentality to let these people know that that is not the truth. A lot of conspiracy theories have been generated about healthcare, with Black and Brown patients being tested. However, we do know that the Tuskegee experiment did occur. It's just one of the examples of that. There's so much mistrust between the African Americans and the medical community. But in order for us to dismantle the fear, people should seek out practitioners they trust, people within the church, people within, their local pharmacies, people amongst their mentor groups, or if they're in professional settings or professional groups. Those are the opportunities that you can reach out and you can have these open conversations and figure out what it is that you should do. They're more likely to accept you for who you are and trust what you're saying. If you or anyone else are engaged with federal, state, or local community members, this is a much more effective way to encourage engagement, just as we're doing today. Let's see here. Now let's move on to what groups should be vaccinated. Currently, right now, we are in phase 1A, and we are 1A and 1B. And this is healthcare workers and residents living in long-term care facilities. And the phase 1B are persons who they changed that to, it was 75, it is now 65. So I guess it's 1A, 1B, 1C. That's where we are currently. I know a lot of patients have probably already attempted to sign up for the vaccine. People don't realize that within these 3 phases of 1, there's about 4 to 5 million people. Currently, most facilities are only receiving 100,000 vaccines a week. So it may take a while. I want patients to understand that they don't have to be frantic. You will receive that vaccine. If you signed up for it, be patient, be vigilant, and just make sure that when they call you that you are readily available. You can check with your local health department's website to see what group you may fall into. Priority groups include, like I said, those healthcare workers, essential and critical care workers, police officers, first responders, educators, grocery line workers, food manufacturers, persons with certain underlying conditions that put them at risk, people who are age 65 and older. Those are the patients that we are currently vaccinating. As far as CVS goes, there are only 4 locations. I think they went from 4 to maybe 8 now, locations within the peninsula that currently have the vaccine available. However, when it comes to making appointments, it is difficult. Right now, it is closed. I would say, really, first, you should have signed up with the local health department. Go ahead, if you haven't already, go to the website. They do have a new system that they've implemented. If you have not already signed up, then you do not have to sign up again. Their information, it will transfer over from the old system to the new. You do not have to re-sign up for anything. But if you haven't already, and you fall within these categories, then you need to make sure that you sign up for your vaccine. The Pfizer vaccine has been authorized for patients over the age of 16. The Moderna vaccine has been authorized for patients over the age of 18. Children and adolescents have not currently been studied, and that is because they have not been recommended to receive the vaccine. However, they are currently studying children with severe medical conditions to be vaccinated. And those patients are over the age of 12. Nobody under the age of 12, they will vaccinate. Let's see here. Phase 2, that is everyone 16 years of age and older. That is for anybody who does not fall in the phase 1 through A1, 1A to 1C. So that'll be the remainder of the population. I do believe that'll be available probably in April for the remainder of the population, because like I said, they are still currently vaccinating patients that are 65 and up with those high risk conditions. I don't want people to be frantic. I believe it'll be available. I think it's a sense of it won't be available or to run out, and it won't. Not when you have all of these different companies producing these. They have the funding for it, so they can meet that supply and demand. As I stated, it is 2-dose series. You need to stick to the same company that you received the first dose to get the second dose. Okay. And in closing, let's see here. If we have any questions, this is my current email address. You can address any concerns to this email address. If you have any questions that you would like to put in the chat and we can discuss for the next few minutes, we most certainly can. Okay, and this ends my presentation. Once again, I want to thank everyone for inviting me to do this presentation, to have an opportunity to speak to those within our community. It's a blessing to be in the position that I am in. I do find it important for us to speak out about healthcare. It is important for us to be advocates of our own health. We cannot anticipate for someone to have total care over our own bodies. We have to be vigilant in knowing what we're dealing with, educating yourself about what you're dealing with. So when you go to these doctors' offices, they can pinpoint and address what it is that you have concerns with. You have to take your health in your own hands. And I think more now than ever, it's important for us to have these conversations. That'll conclude my presentation. Once again, thank you very much for this opportunity. Okay, how effective are the 3 vaccines against the new variants? So what we're finding is that with the new variants, what happens is there's a mutation of that protein spike that let's see here, in the previous slide presentation, I can't go back to it. And so what they're believing will occur is that persons who have already received the vaccine, what they're saying, what they're coming to conclude is that what will happen is you'll continue to receive your first and second dose. And then what will happen is that you will receive a booster dose within 6 to 12 months later. If you have not received the vaccine at all, Johnson & Johnson, as well as Pfizer, are currently working on a booster or a vaccine that is only a single dose that you will receive that will help fight against those variants. We just learned last night, these variants first occurred in South Africa and in London. And I do believe that the first case has just presented itself in Virginia earlier this week. Here. Okay. Well, after having vaccine, is it true that 5 to 6 months later we have to be vaccinated again? And that's what we just discussed. We are noticing that after receiving both doses of the vaccine, they have considered giving a booster 6 to 12 months after receiving that second dose. And that is because of the new variants that we're starting to see. And the new variant that was once in South Africa and in London, I misspoke. I said in Virginia, its first case was identified in the US earlier this week. It was not the state of Virginia. So excuse me for that. How soon after having COVID can a person be vaccinated? I was asymptomatic with the COVID vaccine experience. So what we see here is that soon after having COVID can a person be vaccinated? So before it was 3 months. So now we notice that after 2 weeks, if you are asymptomatic, you should be good to go. You can go and get that first dose. Let's see here. And I answered the other question. It was 4 questions I thought that I seen in here. Let me go back up. Was that it was only 3 questions?
I think so.
Okay.
Yeah. It said for Dr. Pryor.
Okay.
In the chat.
Do we have any other questions that we can answer on the live as well? You don't have to put it in the chat. And as I stated before, anybody who has questions later down the line can always reach out to me. Ms. Barbara Haywood has my information, contact information. I'm also located at the CVS on 700 Merrimack Trail if you have any questions or would like to come and speak to us about it. We currently do not have the vaccine, unfortunately, but we should probably have it, like I stated, sometime in April. If
Okay,
we
I'd
have
like
it
to ask
before
a
that, I
question.
will definitely make her aware so she can spread that information to you guys.
Yes, could I ask a question before you leave?
Yeah, absolutely.
I was the one that wrote the question, but asked the question about the COVID vaccine. So if you had symptoms,
Mhm,
my husband had pneumonia. He wasn't on a ventilator or anything like that.
mhm.
So approximately, how soon would he be able to take the vaccine?
He was diagnosed and he was diagnosed with pneumonia.
Yeah, he was diagnosed with pneumonia. It's been 40 days now.
Okay, and how's his immune system? Is he having any issues breathing?
Oh, no. He's negative now. He's negative.
Okay, yeah, he
Yeah.
should go ahead and get that vaccination. He should go ahead and sign up.
Oh, okay. All right. Thank you.
I am going for my first shot, my husband. Are there any medications that we take daily that we should eliminate before?
The only thing that I recommend is not taking any Tylenol or Benadryl. If you take blood pressure medication or diabetes medication, continue to take that medication. Don't stop it, but do not take anything that stops that anaphylactic cascade. Because what can happen is that, okay, you take Benadryl, you take Tylenol, you don't have a reaction. What happens is that once you receive that vaccination, you then have, you're fine. 4 or 6 hours later, you have a reaction. And that's what we're noticing with the vaccine, is that patients have a latent response due to the fact that they took Benadryl, which stops that cascade. So no Benadryl, no Tylenol. However, after the vaccine, if you notice that you have some redness, tenderness, or soreness, you can't take Tylenol after that. If you develop a rash that you can't control, you can either put topical Benadryl or you can take Benadryl by mouth.
Thank you.
Any other questions? That might be it.
Oh, wow. Dr. Nicole, we just cannot thank you enough. I mean, the information you provided for us, I think we're going to leave today knowing that it's safe, knowing that we need to get it,
Yeah.
and that we just want to be thankful that you've come on and provided all this information for us, and some of our fears hopefully will be less.
Yeah.
And we'll get this vaccine, we will stay safe and do all the things that you have stated, in your presentation. I was listening last night to the Readout show, so if I hadn't known any better, I would have thought you were one of their presenters, because you have just provided us with everything that we need. So we just can't thank you enough. So on behalf of the Health Ministry and St. John Baptist Church, thank you so much.
Thank
And
you.
we'll be seeing you very shortly to show our appreciation with a gift. Okay?
Thank you. I appreciate it. Thank you so
Yes.
much for having me. Anytime.
Yes. Thank you so much. And also, I'd like to thank all the participants who came on this morning. Hopefully you've gained quite a bit of knowledge, like I stated before, and some of your fears are gone, and that we just need to get vaccinated so we can be safe and just do the right thing. And also to Reverend Lassiter, you came on and did our Zoom presentation, so we give you a special thank you as well. And I think that concludes our presentation. If there's no other questions from anyone.
Thank you. Take care, everyone.